Hi, my name is T and I'm a nurse practitioner student at Gonzaga University. Today we go over the clavicle injury in children. So let's go over an overview of clavicle injury. So it's very common occur in children. 87% of result direct from the fall, either like contact sport. They can be like they fall under by the playground, and they often happen in the mid-shaft of the clavicle. Children from younger than 10 years old usually non-displaced fracture, but when they older 10 years old, majority they have the displaced fracture. Let's move on the anatomy of the clavicular. Each shaft bone structure, and then is the interlocation, and then usually exposed to tremendous force, and then link between the upper extremity and the trunk. And you can see that there are two main joints, the acromion clavicular joint here, the stenoid clavicular joint right here. Let's go over the pathophysiology. Due to the superficial subcutaneous location and the ligament and muscle force applied, the clavicular easy fracture. Another factor in the mid-shaft of the clavicular right here is the thinness segment, and they do not have any containing ligament attached to it. There we can divide three different, we call it almond classification, include group 1, group 2, and group 3. Group 1 usually occur in the middle third mid-shaft, and then usually a minimal displacement. Group 2 fracture usually at the distal or lateral due to the pull of the stenoid mastoid muscle, and can result in deformity and high rate of non-union. Group 3 fracture, proximal and middle third, non-displacement, and can extend to acromial clavicular joint. This is a typical clavicle fracture in children. The children usually report a snapping, cracking sound when the injury occurs, and they present with well localized pain over the fracture side. You can see there's some swollen right here, and the fact that generally they can hold close to the body. Okay, the assessment. How do we assess? The patient typically hold the effect arm abduct close to the body, and often they can support another hand to opposite hand because of pain. Physical examination, sometimes we can find edema, ecchymosis, focal tenderness, crepitation or bulgation over the clavicle. And we must perform neurovascular and lung exam due to subclavian vessel, brachial plexus, and lung apex. And then different diagnosis, there are different kind of diagnosis, but I focus on treatment one, the clavicle fracture, and then acromial clavicle joint injury, and then stenoid clavicular joint injury. It's more like depend on location. Sometimes you can determine the fracture, the diagnosis. What kind of test? There are several tests. Choose two of them. One neurovascular test that the assessment will perform for pain, sensation, motor function, perfusion, to run a communication such as compartment syndrome. And then functional test, the acromial clavicular joint, detect in the bus if the patient will complain pain, that kind of thing. Next one, the treatment, we can divide by two for non-display mid-shaft clavicle fracture. Treatment goal to restore normal anatomy, limit pain, promote quick return to activity play by immobilize in the sling right here, and you can activate motion exercise 4 to 8 weeks, and then physical therapy. For display mid-shaft clavicle, it's more high rate of non-union, and both operation management can avoid potential of complication in pneumothorax, neurovascular. And then this is the case examination of patient 8 years old female. she was in the playground and then she fall. As you can see that her hand hold here, and then I can go ahead and here hold. Okay, thank you. Hi Lena, how are you doing today?
Good.
Yeah, I heard that you fall on the gray route today, and you hurt your a little bit in the shoulder. Okay. Let's. Can you have your hand outside a little bit? Okay. So I will do some tests. We call neurovascular test. Let's follow my direction. If you can follow it for me, and then you can put your thumb out, and then you can hold on your thing. Okay.
Like thumbs up.
Yeah, it's okay, thank you. And then I will do the vaccino testing here. Use the thumb push on the acromion clavicular joint. See here. Is feel pain a little bit? Okay. So if the patient report little pain, and depend on the assessment, if you think it's necessary to refer them for the X-ray to rule out any kind of fracture. And then if it's severe, and you have to send them to ER, that kind of thing. Yeah, so yeah, thank you for watching, and I hope information useful, and then for our future practice. Thank you very much for watching. Have a great day. Bye bye.